Hello, my name is Penda Boma. I am a student of Nightingale College. Today I'm going to be performing dressing change using a sterile kit. For this video I have my supplies. I have my modular with the wound inserted in it and a band-aid on it. I have a clean pair of gloves, my sterile kit, and some hand sanitizer. Now that I have my supplies, I'm going to knock on the patient's door. The patient grants me access. I get in, close the door behind me, close the curtain to provide patient's privacy. I get in the patient's room. I introduce myself to the patient. Hello, mom. My name is Penda Boma. I'm going to be a nurse for today, and I'm going to be performing a dressing change on your wound. This shouldn't take more than 5 minutes. I'll go ahead and do hand hygiene in front of the patient to make the patient comfortable. I'm going to do a 2-step check-in for the patient's identity to make sure I have the right patient. I'm going to check their wristband while I'm asking for their name and date of birth. Hello, mom, what's your name and date of birth? While they tell me, I check on the wristband, make sure we have the right patient. At this time, I'm going to go ahead and put on my gloves while I explain to the patient that I'm going to start the procedure. As I'm putting on my gloves, I'm checking the patient for any allergies, accessing the wound as well, making sure the wound is parallel to me. Now that the wound is parallel to me, I'm going to go ahead and take off the band-aid while taking it easy to make sure that the band-aid does not cause any damage to the skin. Slowly. Now that the band-aid is off, I'm going to put this in the trash. I'm going to access the wound for any drainage, any discoloration, and any unusual odor. At this time, I'm going to take off my gloves. Put this in the trash. Now I'm going to open my sterile kit. I'm going to go ahead and grab my sterile gloves, making sure I'm touching just my sterile gloves. My sterile gloves is in a clean and dry surface. I'm going to open the sterile gloves, and for this sterile procedure I have no jewelry on and I have no nail polish. I'm going to maintain my 1-inch border as I open the sterile kit. Okay, I have my sterile gloves now ready to put on. I'm going to start with my weak hand, my left hand. I want to grab that by the curb, walk my way in slowly. It could be really tough putting in these sterile gloves. I'm going to work my way up. Make sure my fingers get in the right spots. Since it's brand new, it's kind of still making sure I maintain that cup, making sure I'm touching just that cup. Roll it up my sleeve slowly and surely, work my way up. Okay, got it in. I'm going to use my 2 fingers now for my dominant hand. Grab it right there. Making sure my sterile kit does not move a lot while I'm going to work my way in. Still maintaining that 2 finger. Maintaining that 2 finger while I'm working my way up. I have my next sterile gloves on. At this time I'm going to pinch. I'm not going to pinch, sorry about that. I have my dirty hand and my sterile hand. This dirty hand is going to be used to pick up my equipment from the sterile kit, and this clean hand, sterile hand, is going to be used to clean the wound. At this time I'm going to grab my cannula, just the cannula alone, put it in my sterile hand, and I'm going to clean the wound in a circular motion. Put that in the sterile kit. I'm going to grab my gauze in my sterile hand, clean in a circular motion, slowly. At this time I'm going to grab my Tagnum. For the sake of this Tagnum, I am retaking BSN 206, so my retake package did not come with extra Tagnum, so I'm going to demonstrate with the one I had from last semester. So here's my Tagnum. For this one I can hold it with both hands, so I'm going to rip the Tagnum off, and I'm going to place it on the wound. Make sure it is nice and well fitted. For remediation, I might take off this one, but since I'm not doing that, I'm just going to leave that on it. And at this time, I have cleaned the wound and I have put a new dressing on it. So I'm going to go ahead and explain to the patient I'm done with the procedure, and then date and tag the new dressing. Take off my sterile gloves. Two fingers in the other one. Out. It's kind of hard to come out. Okay. Finally, we got it out. I'm going to explain to the patient if they need help. They should use the collar. I'm going to reposition the patient in a comfortable position. I'm going to gather my trash, put this in the trash, perform hand hygiene in front of the patient, give them their call light, and go ahead and document my process in the patient's chart. Thank you.